what we've been doing is we want to try and demystify as much as we can this sort of horrible process if somebody actually does get coronavirus within the homes. And it's sort of our expectation that this could well happen at some stage. We have had, I think it's 7 individuals, and Ian obviously was one of them, who actually we thought might have coronavirus, and that in that situation it triggered a set of reactions for us to what we had to do around PPE and isolation, etc. And that actually that would have been no different if he'd had it all, and unfortunately he didn't have it. So we really want to try and get across the fact that we've had a lot of dry runs. We've had, I think it's 107 staff who have had to sort of isolate at one stage or another. So, you know, and where we've had a member of staff, especially under the new guidance, who was working and then had to self-isolate, we've had to sort of roll out the PPE and put everybody in masks and everything. And so we just really want to try and get across the fact as much as we can that, look, we've had the dry runs in a way, and the dry runs were false alarms, but we didn't know they were false alarms at the time. So the issue more about is how how this is going to play mentally, obviously at a mental level, psychological level with our own staff, but also, of course, we're families, and I think that was really wanted to try and capture the perspective, if we can, from you guys, because we really want to just take parents through, you know, what happened, and then perhaps also sort of balancing it out, I hope, with where we were able to be effective in putting your sort of fears, you know, in managing your fears or concerns as well.
So I got a telephone call in the afternoon saying that Ian wasn't very well. He'd got a temperature and he had a bit of a cough, and that he was in his bedroom, and he was going to stay there for the time being, and it was very probable that he would isolate. We spoke to Ian then on Skype in the evening.
Then there was a follow-up email to outline what was said in case a phone call hadn't explained it, which again helps, because emails are, you can read the words more than once or twice, and if it's a phone call you might have asked a question. Obviously the Skype call worked very well. I think the fact that now we could Skype in and see Ian and recognise the fact that he wasn't very well, but also recognise the fact that the things were actually in place, because at that point he was either in his bedroom or in the day ops room, which I think he was using as an isolation part as well. And yeah, you could see he wasn't very well, and obviously that was a bit of a emotional shock, simply because you're not sure whether it was or it wasn't. But as the days went on and you actually made more contact with Ian, you could see he had a high and then a low. But again, it did work because the visibility of it, and talking to the carers, whichever one was on at the time, and even watching your system of operation, because at that point the carers were going around wiping all the surfaces if anything was touched, and they were cleaning. So it did give you a positive sort of feel that things were being done as best possible, and the communication was very good.
Also, I was worried how Ian might react, because by this time, of course, his carers were wearing a mask and gowns and gloves. I thought Ian might be quite agitated about it, that he might want to pull the equipment off, because he can react like that sometimes. But actually, he was great about it, really. But that was because his carers were talking him through it. He just accepted, really, that it was necessary, and he left everything alone. And he was still engaged with his carers, joking and laughing, and he wasn't worried at all, and he didn't bother about the fact that they were gowned and wearing masks. But that was all because, really, of their calm attitude and talking him through and helping things. So it was all to do with reassurance, really, wasn't it?
Yeah, reassurance on the routine. And they just responded in a normal way, so it was quite a calm response to it.
In fact, it was very, very calm. Like, the other thing, of course, you'd worry about, that it's a different routine, change of sort of, you know, he's a little bit more enclosed, obviously, so we'd worry that he'd get anxious, that he might get aggressive, he might get very, very difficult. Having the day ops as another space. So he's got his own little garden, of course, as well, now that he's got his own little garden. That is his little space, and then through that, and then having the day ops, By virtue of the fact that he was sort of confined, he still had quite a generous area in which to move around.
We have looked at the environments of all of the locations and looked at how individuals could have their additional space, because we've got several different types of environment. A lot of people have their own apartment, but for some that haven't, we have looked at how we can give space, because as you say, that day ops access really did help in terms of Ian's anxiety.
The two things that seem to stand out are, one, the communication with you guys, that made a difference, that we were presumably successfully drawing you into it all, so you didn't feel as though you were too distanced from it, although obviously you were distanced to some extent. But it also sounds as though that the fact that the staff were able to maintain routines and just redirect the environment, but actually maintain those routines. It sounds like those are probably the two key factors.
Yes, I would agree with
Yeah, I
that.
agree, yeah.
Yeah.
I mean, Ian was quite accepting of it. He took on board the fact he couldn't go down to the main room in the big house, and it must have been well explained and outlined and repeated enough for him to get the notion of it. Obviously, we wouldn't see that, we just saw the effect, but he certainly could tell there was no doubt in his mind that this is what was happening. I don't know if he fully understood why, but he accepted it. And I think the other positive was at the end, when he was down, and we Skyped him when he was back in the big room, there was a happy jumping about, I'm out with me sort of thing.
It's a party, it's party time.
Yeah, I'm not party, but you can jump about.
I could tell you, we all took a big deep breath of relief, let me tell you.
Yeah.
I think we said, yeah, that's one for the good guys.
Yes, yes.
We're totally engaged in that with every one of them. Yeah, that's terrific.
I just wanted to ask if there was anything that you thought that we could have done a little bit differently to make it even better.
No, I thought you might ask that, but to be honest, it's difficult to actually come up with anything particular.
Okay.
Because I think it did go very well. I mean, obviously, if it had gone, he hadn't recovered and it got worse, I think that would have opened up a complete different set of circumstance. But luckily, it didn't, and that's the way best result, I think. But no, I mean, you can only do what you can do, and at this moment in time, with the communications as best possible, I think he did very well.
I don't know whether it's worth mentioning as well that over and above the government guidance, and not only on the use of PPE, but also the definition of who's vulnerable, we've actually put a separate layer to that. So there's the definition from the government about who's clinically extremely vulnerable, and then those people that are more vulnerable, such as people that are over 80, etc. We've actually got a third layer to that, because we recognise that there are people that have got some conditions that aren't on either of those lists, that actually, if they were to become poorly, they would likely have more severe symptoms or be more poorly than another individual. So the risk assessments in terms of when we use PPE, we've actually got an additional layer to those layers that are sanctioned by the government, if you like, because not everything, particularly for people with learning disabilities, is included in those things.
No, that's right.
No, that's good.
I feel it's an area that they haven't really pinpointed at all.
And if you think of even in terms of over 70s being more vulnerable, if a person with a learning disabilities has got a lower life expectancy, surely that vulnerability should be a lower age as well. So,
yes.
Yeah.
And I think certainly in terms of the guidance that's come out, it's very generic in terms of social care and people with learning disabilities and autism. There are some very specific requirements that aren't addressed in that, but I know there's work going on behind the scenes to try and get something more bespoke for that.
Yeah, I think the problem is, once people talk about social care, then they talk about elder care.
Yes.
We tip our hat to everybody, NHS obviously, and elder care. But our guys have got all of those issues, and they've got more, because you've got all the behaviours and things like that. And what happens when you have you've got an individual, and they love Marmite and they can't get their Marmite, or like a particular brand, and it's actually the precision with which you have to do these things,
Yes.
and the supply chain of everything becomes much more. it has to happen, and it's always got to be just in time in the sense of the delivery. It's always got to deliver at that moment. And if it doesn't deliver, if somebody doesn't get the right food, or they don't get this right thing, whatever it might be, then of course that's where all the issues start. So I mean, I have to say, I think our staff are absolutely incredible. They really are. They really just go the extra mile. And I say that as a parent of Laura, I think it's brilliant.
We may have reservations that Ian was poorly and everything else, but immediately we were just so thankful. Thank God he's there. Thank God he is where he is and he's being looked after. Because
just to summarise, what we're saying at this stage is that families should feel very reassured that the consequences of what has happened to date mean that the homes, most of the homes, have actually effectively at some stage been in a situation where they have believed that they were probably dealing with the coronavirus incident, that they have managed this incredibly well, that they have managed the other individuals, because that will obviously have an impact on the other individuals, and that basically we are very much on top of actually being able to support staff, because the worst thing is if you've got a problem where you feel you're on your own, and I think that's where we've been very successful, is actually creating that sort of level of support. And really what from a family's point of view, the reality is that they will see a lot of PPE in the films, and I think we should actually not go out. We should go out of our way to make sure that we do actually sort of show that, and just do a bit more filming, because this is the norm now. This is the new norm in a way, and they should be reassured by what they're saying, I think.